I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. I have someone that I'm really excited for you to meet today, Dr. Paca Lipovac. Welcome, Paca.
Thank you.
So Paca and I met a few years ago, and it is just, I always love talking to you because the conversation is always lively, but also always very meaningful and valuable in terms of supporting health and health care for people with intellectual and developmental disabilities. So I just kind of want you to give some backstory. How did you get into this field, and what do you do in it?
So I got into this field in 1999 by accident. My niece was born in 1997 with developmental disability. I was in rehab in nursing home field, and it was time to move from that area, and I felt that maybe I should explore the developmental disabilities because at that point I had a personal connection. Mm-hmm. I tried developmental disabilities many decades ago, and I lasted all of 2 days, and it was too sad for me, and I couldn't do it.
Okay.
And when this became personal, because now my niece, who is spina bifida, when she was born, it became more of an attraction for me for the field because I felt that maybe I can do something that's meaningful to people with similar conditions. So I spent the last 26 years in this field, and I love what I do. I have a lot of interests in my life, personal and professional, but I know that everything that I do I want to be in developmental disabilities field. I was really hooked on my week one in working this field because I watched the Willowbrook tape with Geraldo Rivera, the expose, and I found myself with my head on the table sobbing. And I realized that people don't need my tears, they need my work. And that was the moment, literally within my first week of being oriented at my first DD job, that I decided this is the place where I really want to put my energy in and work toward the betterment for people with developmental disabilities.
So what was your first DD job?
My first DD job, I worked as a director of rehab for cerebral palsy system in New York City. And I came from rehab world. I am an MD. I also hold a license as a physical therapist. I'm also a wound specialist. So
I didn't have the physical therapy part.
Yeah. I'm a licensed physical therapist. Yes, I have my master's. I got my master's in the U.S. from the University of Southern California, which is the premier school for physical therapy, and it just gave me an opportunity to do different things. Mm-hmm. As I said, I'm all over the place with my interest.
I do know that.
Yeah. So.
And I appreciate it.
So my first job was in rehab. I came from nursing home industry, being a director of rehab services, and I came to CP as the director of rehab. Learned so much about wheelchairs and positioning. As a wound specialist, I really had the full appreciation of appropriate positioning and repositioning, and then kept learning. After 2 years, I was promoted to be a director of professional services over all the nursing and behavioral services as well as rehab. And I stayed there and kept learning. And I always say I was raised by a nurse, so nursing was very dear to my heart.
Yes.
And I really enjoyed learning the regulations and trying to figure out the way how to do as much as we can for our residents on as little money as Medicaid actually offers you.
Sure. So that's evolved, and now you provide services for people that have a lot of medical complexities, yes. Right?
So for the last 18 years, I've been with Richmond Community Services, and we are known for providing services to people who are very medically complex. We have a large ICF, 83 people, shocking for anybody in this DD world, in one building, but people are really involved. The only thing we don't do is vent care, but everything else you could do in a long-term facility we have people with colostomies and urostomies and trachs and people on continuous oxygen, brittle diabetics. Everybody in that building is non-ambulatory, Everybody uses a wheelchair.
Mm-hmm.
Everybody's full care. They are 100% dependent on our staff and our medical providers to care for them. We have 24-hour nursing, 3 nurse practitioners, and a doctor who are on staff for that building, full complement of rehab staff. So it's a very complex care. We administer about 1,000 doses of medications a day in that building. So that should tell you how seriously ill they are.
Sure.
But I am really proud of my staff because we have people who came to us as babies. We started as a children's center. And people who came to us as babies who are now in their 40s and 50s. And it's so heartwarming to talk to those families who say that their children were supposed to live to be a year or 2 years old.
Yes.
That was the life expectancy at that time. And here they are, approaching 50 or being in their 50s, and still able to live a life that is as good for them as can possibly be. You know, when I think about this field, I really think that my job is to create enviable lives.
I love that. Enviable lives.
Yes.
Yeah.
It's just to create a life that you and I wouldn't mind living.
Yeah.
To really provide supports to everybody that we serve, and offer them a life that would be okay for us, it would be okay for our children, would be okay for somebody you love, because that's, to me, it's important. To me personally, it's important. I think that I'm very fortunate to do what I do, and to have a job that I really enjoy, and it's good to know that we are succeeding in so many aspects of our work, and see people with developmental disabilities find jobs and get married and have lives that you and I want to have.
Yeah, they want the same things that we all want, and that's such an important thing to always have at the forefront of our minds when we're supporting people. You know, with your background and your experience in people that have complex medical needs, do you have some thoughts in general on the healthcare system and how it provides healthcare for people with disabilities, and maybe some directions that you'd like to see it move towards?
Oh, I have many thoughts.
Yes, I know that, and I love hearing them.
I have many thoughts about it. I first think that the healthcare system in the U.S. is not a secret. It's really broken, and it's not working well. It's too expensive. In one of my many interests, I spent 10 years teaching at the college, and I thought healthcare system in the U.S. and how the insurance companies work and how the whole system works. So I am removed now from that, so I don't know all the details, but I would have called myself an expert about 10 years ago on how all of this works. It's overly expensive, it's overly complicated, but we can put that aside. I don't believe I can fix it. But what I see from a provider perspective, somebody who is providing services to people with developmental disabilities, something's really off with Medicaid and the payments of Medicaid for people with developmental disabilities. So what we are finding, people come to us who received the G-tube as a child for whatever reason, and that G-tube now needs to be removed because they don't need it any longer. They're able to independently swallow, they can bring enough nutrients. So the G-tube was there temporarily. 20 years later, it's still there because we can't find an adult surgeon who is willing to reverse a G-tube on Medicaid rate. We have a young man who, when I say 15 years, I mean 15 years we've been trying.
Wow.
And this young man still has the hole sitting there. Stoma is there because nobody's willing to do it.
Yeah.
Nobody's willing to do it at the Medicaid rate. Many doctors are just hesitant to work on somebody else's work, which I understand from liability perspective, but from human perspective, it's very difficult to wrap your brain around it and say, I don't want to do this. But on the other hand, when you look at Medicaid reimbursement rate for physicians and for surgeries, can you blame them that
it's challenging. Yeah.
It is challenging. It is very, very challenging. So the end result is that people with developmental disabilities do not receive services that they need to receive because there's so many obstacles. And additionally, you and I spoke a lot about this. It's the education that's being provided
Yes.
for anybody in healthcare.
Yep.
I mean, I remember being in medical school where I learned about Down syndrome, cerebral palsy, but it was just a little snippet.
Mm-hmm.
And there is so much more in developmental disability outside of cerebral palsy and Down syndrome. So physicians do not receive the training in developmental disabilities. That's why I'm so glad
Yep.
for all the work you do,
Yeah.
because it's so refreshing to me, and I think it's so important. And so you have the combination of doctors and nurses and therapists. Nobody really in healthcare receives the information and the knowledge that they need to have to work effectively with people with DD. And then you combine that with Medicaid rate of reimbursement. So you have people who may mean well, but don't have enough knowledge. And then additionally, they're not too interested because for a business perspective, because unfortunately medicine is business.
Yes.
It just is.
Everybody's got to pay the bills.
Everybody's got to pay
yeah.
the bills, and your education expense and your day-to-day life and your office staff and
Right.
all of that, and insurance. So I don't blame anybody. I'm just simply, just
those are the facts.
that's-
This is what it is.
it's
Yeah.
just what it is. So you have a combination of lack of knowledge, and I apologize to all of my colleagues and everybody in
Well,
healthcare, but it's
I
it's
say
a
it all the
fact.
time. So, and it is a fact. It's unfortunate, and I speak from a place of not having that knowledge myself. And I didn't have the knowledge when I first started in this field, and then learned a lot over the years, kind of the hard way. Which is why I do what I do now, really, to try to take some of these things that I learned over the years, and I know you have tons of things that you learned that you want to teach to others to help them.
Yes.
Be better able to provide health care to people with IDD, which kind of leads me, I know you've got a couple of really interesting projects going on. One of them has to do with training healthcare providers.
Yes, so it's not I've been in this country for 35 years. So when I arrived here, there was a special visa for nurses because there were no nurses. Fast forward 34 years or 35, there's still no nurses. And I believe in simple solutions to big problems because at the end of the day, simple solutions are the best solutions. Sometimes they're most difficult to achieve because it requires a lot of work. But so basically what I did, I'm glad I have a chance to talk about it because I'm very excited about it. So for the last 2 years, I've been working, trying to develop a relationship with the local college where that I can actually send our staff who work for Richmond to become nurses. Because, as I jokingly said to you a couple of days ago, I'm making my own nurses now.
Yeah.
So I was tired of trying to find nurses. First, there are no nurses. And then even those that you find, there are even fewer nurses who are interested in developmental disabilities. And so we are trying to do an undoable job because the pool of available people is so small. And then the pool of people inside of that pool, they're interested in this field, is even smaller. Due to pay, lack of knowledge, lack of interest, lack of exposure to people with developmental disabilities, especially for our building where we have so medically complex people. So we tried everything, traveling nurses, agency nurses, pay through our noses, and yes, you get a body, but you don't necessarily get the quality.
Sure.
So I kept thinking, what is that I can do? And I just thought that if I develop a relationship with the college and they can work around my staff time or schedule, we can maybe form a program. And after 2 years of trying and working with 4 different universities, I was finally able to accomplish that. So our first class started in September. We are working out all the finer details of the curriculum, but the idea is that we have a cohort of 18 people who are Richmond staff who are going to be going through school and becoming nurses in 18 months. The school is willing to work around our staff schedule. I am also willing to adjust our staff schedule to meet the school needs, so it's a full collaboration. And we are now working on the details of the curriculum because I want this curriculum to be really heavy on DD nursing.
Yeah, that is fantastic. I know a lot of people out there are going to be excited to hear that.
I am
Yeah.
absolutely giddy thinking about this. And it was so much work, and I kept hitting the wall. and kept hitting the wall. I tried. Universities were interested, but there are so many fine details that need to be worked out that just sort of just fizzles out after a while, and people go, oh, maybe we can see this. And one of the biggest issues for us was the cost.
Sure.
You know, we're a nonprofit organization. It sounds great. I'm going to make my own nurses. Who's paying for it? And if the tuition is $60,000, times 20 people,
it's expensive.
I have to go in front of my board and explain that I need $1 million plus to make my own nurses. It just, the concept stops flying at that point because it's just too expensive. So this university worked very closely with us. This is going to be fairly inexpensive.
That's great.
Little more than what our regular tuition reimbursement would be for a full-time staff. And I can certainly make that commitment because now it's not a significant amount of money. And it's certainly, for all 18 nurses, the financial output outside of our tuition reimbursement would be probably about 50% of what we would pay an agency for one nurse.
Wow. That's, that makes economic sense for sure. And I know that's only one little project you have up your sleeve. Let's talk about the other one. All right, let me say this first. So we all know, if you work in this field, you've heard over and over again about direct support professionals and the shortage of direct support professionals and the rapid turnover and so on and so forth. And you hear, people get together and say, well, what can we do? How can we do this? And there are lots of good, things that people are working on to do it. Your approach is very innovative. Would you share that?
Yep, of course. So again, I believe in as simple a solution that one can come up with. And as a provider, as the CEO of this agency, I spent many sleepless nights being very worried about what's going to happen. And we tried every trick from a book. Literally everything that one can try to attract people, to retain people. The fact is, we are not paying enough. Right. That's the bottom line. Yep. We're not paying enough, and therefore we are not attracting the people because they can go and work somewhere else for the same money or more, doing
with less responsibility, less stress, often
less work.
Less work, sure.
Less work. It is a labor of commitment to people with developmental disabilities to be able to be a good frontline person and work with them effectively. And so we at Richmond had this constant turnover. And one day we found ourselves at 48% staffing vacancy.
Wow.
Considering who we support, it's unsustainable. You just can't. And no matter what we did, we were giving sign-on bonuses and retention bonuses and referral bonuses and trying everything and anything. Offer a meal for staff. Give them money, a stipend for every mandated shift. Give them a stipend for every volunteered shift. Nothing was producing appropriate results. I mean, if we were paying $40 an hour, we would have way less trouble. But
sure.
We are located in Westchester and in New York. It's an expensive area. It's nearly impossible to live there with what our staff makes. And it's not that we don't want to pay them more, but that's what we get through Medicaid.
Sure.
So it became a real issue. And I had, and I'm quite sure anybody who runs an organization would know that feeling. I had on repeat this picture in my head of a particular resident who would like to elope, running out in the middle of the night because my staff are asleep because they're working 4 shifts straight.
Yeah.
So I didn't know what to do, and it was just like, we need to do something to fix this. So that's when one of my colleagues, actually I didn't come up with this, one of my colleagues did, and he was telling me that they are doing this at a much smaller scale. And I became very interested. So basically is elevating the DSP job to a higher level job, which is more in line with the rehab counselor, which does pay slightly more. But we've been bringing staff from abroad. Mm-hmm. We currently have about 170 people working for us who are excellent. I mean, they're really doing a great job. Our retention rate is 92% over a 4-year period.
Did you hear that? 92%
yes.
over 4 years retention rate.
Yes.
Yeah. So how does it work? You find people that are interested in coming to the country
Yes.
to do this kind of work, and just talk more about it.
Yeah, we interview them. So there is a second component to this. So we start first bringing people to our own agency, and then because we were so excited about it, how successful this is and how great this works, and by no means this is not easy. I mean, this
No, certainly not.
it's a process that requires a huge commitment, and I'm very grateful to my board for allowing me to do this and supporting these efforts, and all my staff for participating and doing what they needed to do. But because this is certainly not one person's job. But so we started bringing people, we source people from around the world. We make sure that they meet the requirements, educational requirements, their interest. We interview them, and then we put them through the immigration process, and they come here. They're on a 3-year visa with the potential of extending it by another 3 years. So you basically, for the investment that you make in bringing that person on, are getting a staff member that can only work for you as the employer, and they can be here for 6 years. Think about consistency for the recipients of the service, residents or day program participants, whatever service we are talking about. Think about not having to be showered by a different person every time, not having to have an intimate care provided by a different person every time. You have the person you know.
And think about not only that, but the staff person knows that person well, and they're better able to detect smaller changes that might be an early sign of a much bigger problem if it doesn't get addressed. So that continuity is huge. Yeah.
In our large facility, we actually have staff that have been with us for 30 and 40 years. And I am so amazed with their ability to diagnose things. It's amazing because they really truly know them. When you have somebody working there for 20, 30, 40 years, our longest working person was our director of nursing, and she was also director of professional services. She worked for us for 50 years. But our DSPs who've been there for 20, 30, 40 years, even when objectively, as a physician, you're looking at them and you're seeing nothing wrong. Their vitals are okay. Their color is okay. They look fine. There is nothing that you would go, oh, this is off. Our staff sees that, maybe there's a little twitch in the corner, and they know what that means.
And the key to that is when a staff person tells you something's not right,
you better listen.
You better listen.
You better listen.
Yep.
Because they know them. And so from that perspective, it is so important. It really allows us to do a better job and a better service to our residents because you provide that consistency.
So I'm sure people, so you started bringing in people to work at your program, but now you're beginning to bring in people to assist other programs.
Yes.
Right?
Yes.
So I'm sure people will have some questions or interest. What's the name of the company?
It's called the Richmond Staffing Solutions.
Okay, Richmond Staffing Solutions. And how can they find
Well,
find
we
you?
do have a website, and on our website, so what we do is we go. There are two parts of our business. One is consulting, so we go in and we work with the provider to assist them in setting up this program, to create a position that is different and that that meets the requirements, and then we do the training with their management staff, because the key to this is to create an environment that becomes a village for these new people coming in, that we can embrace them and make them feel welcomed and teach them everything they need to know to do their job. So we work with the management team in assisting them with developing all the systems and policies and procedures. And then the second part of our business is that we source people from abroad. And what we do for a client, we verify the diplomas, we verify driver's license, we do a criminal background check in their country. So once the candidate is presented to a client for an interview, we already know that they are fully set. They qualify, they're ready to go. We do the initial interview, and we only put forward people that we feel comfortable are the right fit for this field. So we brought over 500 people to our clients so far. We've been in existence for a year.
Wow.
We're doing really well. There is interest once people see the benefits of this. So I'll just tell you this. We have a minimum number of people that a contract requires. None of our clients stay at a minimum number.
Yeah.
The moment people start coming in, they go like, oh, we want more.
And they see it working,
Yes.
and the quality of the direct support professional, I'm sure, is excellent with the screening that you go through, and they're interested in their job and want to be there. And to mention again, 92% retention rate
Absolutely.
is unheard of.
Yes.
Yeah,
It's amazing. And, what it did objectively for us, like measurable, the number of incidents and investigations decreased because you have
That's a stat that is so important. Yeah.
motivated staff that want to be here. It is a little more difficult with the current climate, but we're managing.
Yeah.
We're able to do it.
And climates change, as we know.
Climates change, absolutely. They come and go. The need stays.
Yes.
The need of
yes.
people with developmental disability stays. And as I said several times already, I have many interests, but all of my interests are in this field. And I am committed to making the best life for everybody who we support, not just my organization, but any other organization. So we'll weather whatever the climate is.
Yep.
We'll go into the next climate and we'll figure out. But this works. We have 4 years of data that shows that this works. And we are happy to assist anybody because it really, truly makes a difference.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. So, Paca, I always ask guests to tell us 3 things, 3 tips, 3 words of wisdom, 3 pieces of advice that you would like everyone to know that you think can improve the world, supports, services, healthcare, whatever it is for people with intellectual and developmental disabilities.
You know what they say, if you're a revolutionary before the 20s, that's the right thing. If you're a revolutionary after your 20s, you're a fool. So I fall into this later category of a fool.
I wouldn't call you a fool at all.
But I do really strongly believe I can change the world, at least for people that we support.
Yeah.
So first thing first, from the first piece of advice that I received and I always give to everybody is, it's so simple. One of my former bosses, my great mentor and a friend who unfortunately passed away, he was also my board member for a while, Dwayne Shelkey, who worked for CP of New York State. I heard it first time from him, and he said to me at the beginning of my career in the ED field, he said, do you know how to treat a person with disabilities? And I looked at him like I expected some deep words of wisdom.
Yeah. Mm-hmm.
And he says, like a person. And he's
well
so
said.
stuck with me that it's a person.
Yeah.
So when I talk to my staff, I always tell them the way that I think about this field and people that we support, I think what would be appropriate if you didn't have developmental disability. So as a grown man, would it be okay if I insist that you share a bedroom with somebody you don't know?
Right.
It wouldn't.
No.
So why is it okay for somebody with developmental disability to have to do that? So, sometimes there are financial constraints and building constraints. All of our group homes, except for one, are single bedroom. And I came to Richmond, we had 8 group homes, and now we moved to 16, closed down one because of COVID, and decided not to reopen it because it just didn't make sense. But all of the new group homes were built to be single bedrooms, and then wannabe architect in me went around other group homes and worked with an architect, a real one, to create single bedrooms wherever we could.
Nice.
So really treating person like a person. And so take away the disability. Treat them what they would need if they didn't have intellectual developmental disability. And then you put the disability back in and figure out how to support them, how to put the systems around that are going to embrace them and allow them to live as you and I want to live, that enviable life. With support, what support do they need to get there?
Well said. Number one.
Simple.
You got simple. Number 2,
So number two, respect. And I say this always to my staff, and I really try to live by it. Any relationship that works is based on respect. We can dislike each other, doesn't matter. But the relationship is going to work as long as we respect each other. I am truly deeply respectful of the fact that somebody's disability is offering me a life that I'm living, and it's offering a life to my family. And if you are respectful of the fact that somebody's disability is doing that for you and your family, you will do your best to treat the person the way that they need to be treated. It's just, it's just simple. If I'm respectful to you, I would not take your wheelchair and park you in a corner. That's the lack of respect.
Sure.
If I have respect for you, I will come right away as soon as you need something. I wouldn't let you sit and wait for me. I would meet your needs because I have respect for you as a person, and also respect of the fact that your disability is providing me with a livelihood and my family.
Sure.
It's just, to me, it's simple.
That's a perspective I don't think we think of that often. I'm glad you shared that.
To me, it's like super simple.
And what's the third super simple thing?
It's really, I know it's not so simple, but it's simple. I really think that the fact, the only way to do this right is it's a village, and if we can create a village for people we support, but not a fake village. Try to really work on developing natural situations and natural connections and natural supports. And that is right now even more difficult because, with all the Medicaid cuts and everything else, that we don't even know what's going to hit us once that goes into effect. It's difficult to do. It's difficult to work with the staff that is living on the poverty line, that their SNAP benefits are not there, that they are, it's hard to work on that, but we have to continue. We have to continue with these natural relationships that are happening, with understanding that people are people. I fall in love. I like you. I want to spend time with you, but I cannot express that because I have. I don't communicate through words, or I don't communicate well. I didn't develop a way of communication, but I still like somebody. It is our job to create an opportunity
to help,
and to really work on that. That is not a simple thing, but again, embracing somebody and making them part of the community in a meaningful way, not because community inclusion is something we're mandated to do.
Yeah. Look, Paca, every time we talk, I gain knowledge and insight. I'm stimulated to think about new things, and this conversation has been no different. Thank you so much for sharing your insights, your wisdom, your experience. But more importantly, thank you for the incredible work that you have done and are continuing to do in this field.
Shared feeling. Thank you. I do appreciate everything you do. I think it's amazing. I tell everybody you're a rare breed, being a physician who actually cares about this field. And this is no shade on any of our colleagues, but you are a rare breed. I am amazed with all the work you're doing.
Thank you very kindly for
you
that.
As you, and you as part of Interactability. I think it's necessary, and it's really making a difference. So thank you for that. I really, truly appreciate it.
Thank you. How do people get in touch with you one more time? Richmond
StaffingSolutions.com.
Okay, remember that. Thanks again.
Thank you. Thanks.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.